Very good afternoon. Welcome to our live conversation. I would like to welcome Dr. Suresh and Dr. Gita Arjun. We have been looking forward to this interesting conversation of today's for quite some time now. The whole idea is that when we are, for me as such, when I was doing my medical practice or when I started off with my private practice, the thought has always been that how do I develop myself, how do I become good in my work, and how do I become popular in whatever I'm doing. So we look at inspiring figures, and Dr. Suresh, I am sure, is an inspiration across the medical fraternity. It's not only about the people who are doing ultrasound, but anybody who is a doctor would definitely want to become as great as him, or at least walk on his path, because there are so many things which you learn in practice. There are some things which are totally focused on developing your work or your financial status or your patient load, but there are so many other things which we eventually pick up from the great personalities that we come across in our life in our medical field. So today we are having a wonderful personality, Dr. Suresh, whom we are hoping to interact with to get to know about his way of thinking and how he likes to prepare himself or work his way in his field. So, Dr. Geeta, may I request you to kindly introduce Dr. Suresh briefly?
Thanks, Suresh. Thanks, Rajesh. It's such a pleasure to be here again with you and, of course, my good old friend Suresh. Suresh and I go back 40 years. We met for the first time in 1981 as soon as Arjun and I had come back from the US. And I'm going to go straight into the fact that everybody who knows Suresh also wants to know his origin story, the origin story of Mediscan, the origin story of Suresh and Indrani, who just completely changed the way diagnostics are practiced in India, particularly as far as ultrasound is concerned. Just like every other person who had some ambitions and then had to pivot. Suresh, what was it that you wanted to do as soon as you finished medical college, and what made you pivot towards ultrasound?
First of all, Rajesh and Gita, thank you very much for asking for having me here today. And the question is a very interesting question because every medical graduate has some ambitions which they nurture as they go along. And during my MBBS course, I was very fascinated by surgery. And we had a surgical professor who was absolutely fantastic. And I said, in my life, I want to be a surgeon. That was what it was. So as soon as I finished, I was looking for to become a surgeon. And that was my only ambition in life. And of course, I had another inspiration, and I took my thing a little bit too far because during my uncle was a neurosurgeon, and he was a fantastic neurosurgeon. And I told him I want to be a neurosurgeon. So surgery and neurosurgery, you're studying in second year in college, and you're pitching your thing saying that you want to become a neurosurgeon. So finally, he said, "You first finish your MBBS, then we'll talk about it."
So what led you to ultrasound ultimately?
Okay, so what happened was I'm very happy to say that those days they gave you grades instead of marks, and I had an A plus in surgery, and I was told that okay, you're the right material for becoming a surgeon. But like the Muhammad Ghazali who invaded 8 times for trying to conquer, I invaded this realm of getting into a surgical program for 6 times. And the sixth time, I said, well, I need to do something more to make somebody out of me. So I left the surgical ambition and moved into ultrasound. Very interestingly, we had a group of 4 friends who all had similar ambitions and working as a honorary assistant in voluntary health services. And at that time, we decided what are we going to do with our lives. And that point, we said, okay, let's start a big diagnostic center in Chennai. And we made a huge list, which went up to some 3.8 crores was the investment needed. And our salary was 350 rupees. So we said, well, well, let's look at something else. And then we said, I had a bright idea. I said, let's tick off whatever is available in Chennai, what's not available. And we came to ultrasound. Interestingly, each of us looked at each other and what is ultrasound? We knew that something was there. And then I offered to go to the British Council Library to go and read up about it and come back. And then so I went and came back in 2-3 days time. I said, friend, this looks like you can see gallstones, kidney stones, and maybe used for pregnancy. And I think we should try and explore this area. So that was the genesis of that. But we were completely groping in the dark at that point. So, and then came, you realize that there is one person who comes and changes your thought process. And that person came in the form of Dr. Arjun Rajagopal. Now, he was in the same hospital, joined as a honorary surgeon. And I went and quite told, because I knew he had come back from the US. And I told him, Arjun, I'm planning to do a ultrasound. He said, don't even hesitate for 1 minute. This is going to be the future. Go ahead and do it. And that decision was made that day. That particular day, the decision was made.
Right.
So that's
how
how it
was
is.
everybody has watched you, everybody has seen you and Indrani grow Mediscan to be an internationally known center. How did that happen? How did a Mediscan, how was it born? And how did you ultimately become literally the father of ultrasound in India?
Yes. So first of all, the question is, once we made a decision of doing ultrasound, rest of the 4 friends who were discussing with each other, we want to go ahead. Then each one came up with their own ambition. One wanted to be an endoscopist, one wanted to go into family practice, other wanted to become a plastic surgeon. So they all, and I was like left alone. And the only thing I had was either a surgical practice or this one. Now, after training for 6 years in surgery, I said I have nothing else more and I can't go into surgery at this point. So I was left alone and then I decided to take it up. The issue was somebody had to teach you. And we were looking at, interestingly, see how things change, providence changes. Indrani's teacher, Professor Jayam, was a pediatric professor. And we went and told her we want to do ultrasound. We are looking for somebody who will teach us. And she said, I went to a pediatric conference and there was this Dr. Merchant from Bombay who presented a paper on ultrasound. So I'll give you a letter to him. You go and meet him. So she gave a note to Dr. Merchant. We went both of us went to Mumbai, met him at the Children's Hospital. And he laughed at us and he said, well, I presented a paper, but I don't do ultrasound. And that was interesting, isn't it? But he said, I have a very good friend of mine at Harkishan Das Hospital, Dr. Hemant Shah. You go and meet him. So with great reputation, we went to his clinic and we found this hospital, the ultrasound department was full of patients. And when we went, he was, of course, Dr. Merchant had given us the introduction. So he welcomed us. He said, wait for some time, have a cup of tea. And after finishing his work, he said, what do you want? He said, we want to do ultrasound, we want to learn. He said, I have never trained anybody so far. Then I gave him a small deal. I said, 1 week, if you allow us to be here, you can assess whether we are trainable or no. And then you make your choice. If you say we are trainable, I'll come back for a longer stint. He said, that's a good deal. And then 1 week later, we were about to leave and he said, I'm ready to teach you, only one condition. And that was the most important condition. He said, you must leave off your surgical ambitions and practice, do full-time ultrasound. If you are willing for that, then, I mean, I was operating 6 days a week. Surgery was everything in my life. But so I said, okay, I need some time to make this decision. Came back to Chennai. 2 days later, I called him and said, sir, I'm ready to leave everything and come. I don't know what made me do that. I just went ahead and did it. That's it.
Yeah,
I
I
guess
know
that's a
this.
very important key point because even for endoscopy, I always feel that you have to have the passion to give up obstetrics, to give up vaginal procedures, to give up even your OPD and just to surgery.
Yes.
Interesting question which I have in my mind is: suppose you would have decided to stay with surgery, how would it have panned out? Whether you would have become a father of laparoscopic surgery or you would have still.
No, no, no. See, if I had decided to stay in surgery, I really don't know how it would have panned out because I would have given everything that was needed for that. And luckily, I had several mentors. Dr. N.S. Murali was there, Arjun was there, a lot of very good surgical people very close to me. So I probably would have taken it and to the level whatever was required because I had to give the 100% to whatever I was doing. That was the. But here I was trying to make a career. I thought the career had come to an end. I was trying to make a career, so I had to put 200% to make sure that I stayed relevant.
I
No,
know
but I
because
guess in
I
today's
know that.
yeah, in
Go
today's
ahead.
consideration, the focus has to be 200% for anybody who is now coming in new into the medical field.
Absolutely.
Yes.
I know Dr. Hemant Shah had a huge impact on you.
Yes.
In this current clinical scenario, no doctor will proceed without an ultrasound. I mean,
Yes.
take any specialty in medicine, the
Yes.
ultrasound is absolutely important. But in the early 80s,
Yes.
what was your experience and what did you do to spread this knowledge and make sure that people were even aware of this modality?
Okay, I'll
How
share
did
a
you do
very,
that?
I'll share a very interesting anecdote. Very interesting anecdote. So, as a young doctor, one of the major milestones that again a decision, what Dr. Hemant Shah told me was there were two types of machines available. One was costing 50,000 rupees. The other was costing 7 lakhs. And 7 lakhs was huge at that time, really huge at that time. But Dr. Hemant Shah said, you buy the machine of 7 lakh, that's a real time machine. The first real time machine, you're going to put it in private, but do it because your limitation of interpretation will be there, but you need good images for interpretation. So he said, go for it. And I simply believed him and then went for it. So that was really a big decision that was made. Now, having said that, the question of providing the service, you need to have the confidence that you're doing the right thing. And when you need to have the confidence to do the right thing, you need the experience. And I had like zero experience. What I had seen in training was a minimalistic training in the old type of machine, and this was completely new. So the one thing I said was I have to equip myself first, and the only way I could equip myself is to provide this service free of cost to uh, government. Kasturba Gandhi Hospital was the hospital where morning OPD 7 o'clock I will be there with the machine and do all patients. Only one condition that if I do something wrong, please come and tell me. If my diagnosis is wrong, I say fibroid, you operate tomorrow, then it should be fibroid. If it's ovarian cyst, then I have a problem here. I need to go back and look at what it is. And that really was the one which sort of laid the foundation, I should say, in terms of gaining the knowledge, because there were no immediate mentors surrounding you. And
See,
we had
yeah.
to, yeah,
I agree because I think what youngsters are missing is that you can't say, I am going into this and from day one, I'm going to make tons of money, even if
no,
I, just do haphazard work or not to the mark work. You clearly showed that if you're going to do anything, it has to be perfect. And for that, you were willing to give up everything else. You were not looking for the money. You were
yes,
making sure that you were getting the experience.
yes,
So that
yes,
is a extremely important life lesson. So how
yes.
did you go about spreading the knowledge or
Yes,
spreading the information about ultrasound? What did you do to make sure
yes,
that everybody knew you had a machine?
yes. So one of the very first decisions that we made, that I made was uh, that every single patient I will document it. And those days, document means taking 35 films, going to the dark room, developing it, making prints, and making sure you store the negatives. That was very important because if you want to teach somebody, you have to have an archive with which you can teach somebody. Now, why was the decision made to teach somebody? I found patients traveling from Tuticorin, Kanyakumari, or here in Andhra Pradesh or Karnataka. People were all coming. They travel like thousands of miles to have an abdominal ultrasound, which was costing just 250 rupees. They were spending 300 rupees to come and get a scan for 250 rupees. And they had to go back. And not one, but the family had to come, accompanying them. So I said, this did not do. This is the modality which must be available everywhere. So we opened out, from 1 year after we started, we opened out a small training program where people used to come, then spend 1 month time, and then whatever was it. Because in that time, you could impart that knowledge available, my little knowledge of ultrasound, we could give it off in 1 month without any difficulty. Today, it's not possible. Yeah.
But so that again, second life lesson, whatever you have, the more you share, the bigger it becomes. Because
No,
ultimately, by sharing your knowledge of ultrasound, you manage to spread it all over. And it was literally at point of care. Everybody.
No. The trick was this is a little secret which I said. If I had to teach somebody, I had to make sure I am telling them the right thing. So when I said, okay, at 2 o'clock I'll take a class for you, and 1 o'clock I'll go to my room, lock my room, and sit and study. Okay, what am I going to tell them? I make sure that whatever I studied. By that, what happened was I started imbibing. So I said, I can't tell the same thing again and again. I have to go and tell something new. Go and find out something new, and then try to say that. So it was a matter of self-improvement. That knowledge sharing was actually a huge self-improvement, and it carries on till today.
Right. You talked about charging 200 rupees and 250 rupees, okay, at the beginning of your career. And we know, and it's an unfortunate part of medicine, which I abhor and I think should not exist, is incentives for people to send you patients. Has Mediscan ever done that? And at this time in your career, do you ever offer that? Have you had a problem building up your practice if you haven't done that?
First of all, we have never done that. We have never thought about doing it. And in fact, the only thing was I said, I'm a professional, you're a professional. I'm going to give some expertise to this patient. You are going to give some expertise to the patient. Ultimately, patient is going to be healed by that. So we are both partnering together to heal that patient. So I don't interfere with anybody's professional fee. So I prefer no one interferes with my professional fee. But if a patient cannot afford, you please let me know. Absolutely no problem. We will do it on the house. Like that, thousands of patients we have done on the house if they cannot afford. So
Absolutely.
we can extend it to the patient, no problem.
Absolutely. No question about it. And I think that is the base of the way your practice built up. And the other thing that I feel that people have lost or have not understood is that you are a diagnostician. And unless you communicate with the referring doctor, the patient doesn't benefit. So have you always had this conversation with the person referring? Have you followed up? What is it that you did to make sure that from the time you made the diagnosis till maybe in a pregnancy, the baby was delivered, how did you follow through?
So another secret I'm going to let out. Okay, one thing is, please remember I was a very young doctor at that time and just entering totally new modality. And the clinicians who were all referring cases were much more senior to me. And I strongly believe they had much more knowledge than what I had. So then when I was doing the scan, in case I found that I am not able to make a diagnosis, I call the clinician and tell them, you are given a clinical opinion. My imaging is not matching with that opinion. So I don't know what to do. So I draw my line, Lakshman Rekha. I said, I don't speculate anything, but this is what is happened. I'll give you a small anecdote. A very, very senior obstetrician, Dr. M.S. Lakshmi Kumari, who's very famous for her extraordinary clinical skills. She sent a patient saying a lemon-sized mass is felt in the pelvis. And I did the ultrasound. No mass seen. I was very confident there was no mass. But I was afraid to give a report. So I called her and said, ma'am, I'm a little concerned about this. You have said lemon-sized mass. I am not feeling a mass. I don't know what. No, doctor, there is a mass. She was very confident. So I called the patient again. I gave her Dulcolax, this, whatever. I said, let's see. Again, no mass. So I said, the clinician is feeling the mass. Ultrasound, there is no mass. However, the final diagnosis has to be arrived at after further testing, investigations, or surgery. So next day, the patient got operated. And then what came out was a dermoid cyst. And then I went back on my images, and that's the when I read a new paper that the tip of the iceberg sign is how you make a diagnosis. If somebody feels a lesion and ultrasound does not show it, it's most likely a dermoid. Huge lesson. And this was, after that, we never missed a dermoid. Never. So this was I mean, small things, but it made a huge difference in
Right.
your
And having watched you for so many decades, I know that you are the champion as far as the patient is concerned and as far as the fetus is concerned. You have devoted your life to that. You have made sure that I mean, we all as doctors, we may miss something, we may misdiagnose, but you always went back and learned from your lessons instead of standing on your this thing and saying, oh, I am so great, I know everything about it. So I think that humility is what is a very special part of you, Suresh. Now, there are procedures you have done over the years. You have learned more and more procedures, invasive procedures. And I know that they all cost a lot of money, some of them. How did you manage that mismatch between what a patient could pay for it and the necessity for the procedure? How did you manage it? Because very many times the patient can't afford a very expensive procedure, but that was what would save her or the baby.
No, there was no issue at all, because see, whatever when we do when we do any procedure, when I find there is a need for any fetal procedure, is potentially a life-saving procedure. We don't do therapeutic procedures. We don't embark on it unless it's absolutely and totally required for the patient and that life need to be saved. I always felt that the cost of the procedure is actually equating with the life of that individual. I don't know, when this baby is born, it could become another Abdul Kalam or somebody in life. We have no idea what's hidden inside that. So I cannot equate that money with this one. And there is a very, very interesting anecdote for this, if I may, that this woman who comes from a very remote village, poor village, comes with a massive abdomen, with a triplet pregnancy with one trap sequence. She needs an immediate procedure, and I had that material to put inside, which is called as the embolization coil at that time, and she agreed. And I put the coil, admitted her in a government hospital, and she was taken care of. The baby was delivered, and the cost of that coil was 65,000 rupees. But I didn't mind it, because it was like she's having a twin pregnancy, and those babies were born alive, and she had a family. Now, this came out in the papers, and a few days later, somebody walked into my room. I still don't know who she is. She said, "Doctor, I want to know about this." I explained to her, and she immediately pulled out 65,000 and put it on my table. I was aghast. I said, "What is this?" She said, "Who are you?" She said, "I don't know. I don't want, don't worry about who I am. Consider me as your well-wisher. You should not be spending money from your pocket, and this is what is the money. This has happened to me several times along the way, and I strongly believe help will come when it is needed. The world is, there are excellent people around the world, around you. Many people are watching what you're doing, and when you have crisis, people will come to your help. So, no problem. Just close your eyes and do what you're supposed to do. That's it.
I absolutely believe in that because I have had so many patients, especially coming from rural areas, cannot afford anything. And I've always, just like you said, that I've always found that we went ahead, did the procedure free of charge, and then somebody, for whatever reason, gives a big donation to the hospital saying, "You saved my baby's life." Somebody completely unrelated, doesn't
Exactly.
know about this, and somehow it gets taken care of. So I believe that the universe takes care when you go ahead and show compassion. It will come around, and you don't have to turn down anybody because they cannot afford the procedure. That I
Yeah.
totally agree with you.
Yes.
I wanted
So
to ask Dr. Suresh something. What drives you, or what has driven you to develop ultrasound itself? I mean,
No,
has there been
no.
some
Actually,
specific?
see, necessity is the mother of invention. Okay. Now here is as a young doctor fighting for my career, and I wanted to. When I said I'll take up ultrasound, I said let me give it my full 100%. That's it. And then I keep doing. And that time because it was not available, I probably had a first mover advantage, and people started referring. And when if some good reports were going, people had developed faith in the system, because at that time, remember, clinical examination was far better than any other thing. You had only X-rays at the time, and and in fact, one or two senior obstetricians whom I went and met, they said my hand is better than any ultrasound machine. This is exactly what they told me. I said, fine, but let me also try to do what little I can. So it was important for me to ensure that this modality, which had huge potential, was exploited to its fullest extent. That is, in terms of capabilities, and the quest for doing more and more came from the fact we wanted to explore the technology rather than anything else, and rest was automatic.
that's fantastic, Suresh. Before we wind down, because unfortunately we are coming to the end of the session, I'm going to ask you for three things that you are very proud of achieving in your practice. Three things which
Okay.
make you stand apart.
Okay, point number one is documentation. Right from day one, I ensure that all my patients' records were available, not a single thing. When they came for repeat scan, track them through their multiple pregnancies. And I'm very happy to say, uh, babies which were born when they were inside the uterus, I mean, we have seen were scanned when they were inside the uterus, they have had babies and they have come back to me, and I've been able to track back their in utero life and tell them this is how you were when you were inside. So that's a huge thing, and it has helped me a lot in terms of tracking and all that. That is point number one. Second point is not worrying about whatever be the state of the patient, not worrying about taking them in, and at the same time sharing the knowledge with as many people as possible, so that this modality could reach. With 25 million births, we need huge amount of number of people doing ultrasound all over. That was the second. The third one is I always called as Lakshman Rekha. Now, I have a Lakshman Rekha which I will never cross, which means the moment I come to a point where I'm stuck with something, I do not go and speculate. I'll say, this is all I know. We have probably have to move ahead and do something else to come to a final run, or take the help of other specialists who will be in the field, put their heads together, and then make it happen. So you have set boundaries for yourself, and don't cross those boundaries.
Yes, no man is an island, and particularly in
Yeah.
medicine, I think we have to take the help of all our other colleagues, other specialists, and make sure that ultimately what the patient gets is the best. Rajesh, you want to conclude?
Yes, I would like to put across a few points before we wind up. As we had discussed earlier, One important point I would like to highlight is that Dr. Suresh has really become a legend, and so has Mediscan, like we were discussing, that people get ultrasounds done and then they get a Mediscan done. So getting an ultrasound in pregnancy is a different thing, and getting a Mediscan done is considered as a brand in itself. That unless you have a Mediscan done, probably in Chennai or in that entire state, you have not had an ultrasound done for obstetrics, is what has become the landmark. And it's really wonderful to be able to achieve that kind of a finesse or that kind of a reputation, that this is a part of normal routine pregnancy to have a scan done by him or at his center. Something which really inspires a lot of people. When you were talking, I realized that though we are talking about your development in ultrasound, it holds the same truth for even like me or people in endoscopy. You mentioned that you need to equip yourself. You need to equip yourself with the equipment plus with the ability to use that equipment. And both these things are equally important for a new person who's coming into practice. I really would like to thank Dr. Suresh for his time that he has spared with us today, as well as Dr. Geeta. Thank you very much for being with us. It has really been an interesting session, and we hope to have another session with you soon later.
Thank you. Thank
Thank
you
you.
very much.
Pleasure. Pleasure. Bye.
Thank you.